Not bad today.
Good, good. I want to check your glands and see, oh, it's pretty good.
Diagnosis can be a slow, frustrating process. Typical is the experience of CFS victim Bruce Morley. He speaks with specialist Dr. Carolyn Dean.
I was diagnosed originally with maybe colitis in the bowel.
Yeah.
And then I went to numerous doctors, and then they thought maybe it was, I was in the hospital for about 2 years ago for 4 days, and they thought it might be the heart.
Oh.
And I'd seen quite a few doctors in between, including a psychiatrist who thought I was having possibly panic attacks and wanted me to take antidepressants. I kept searching for another doctor. I have a twin brother who has the same problem, and he found a doctor who specialized in this chronic fatigue syndrome thing, and she turned up what she thought was Lyme disease. I did take some treatment for Lyme disease, briefly antibiotics. I continued to decline, and then in April they put me in the hospital for about a month. And some doctors felt they were treating it like depression. Mm-hmm. But I always say, which came first, the chicken or the egg? Mm-hmm. If you had the flu for 2 years, wouldn't you be a little depressed?
These are Bruce's files, and he's fairly typical of people I see with chronic fatigue coming to me with dozens and dozens of lab tests and reports that have been done to try to diagnose a condition that has so many symptoms and so many possible causes. Some patients I've seen have been to up to 30 different specialists in 1 year alone. One lady documented that she'd been on $5,000 worth of medication in one year for all her different symptoms. Have you had any athlete's foot or...
Some chronic fatigue specialists, like Dr. Carolyn Dean, are practicing naturopaths.
How's your vision? Any blurriness?
I just went to the...
Dr. Dean treats many of her patients for yeast infections.
Everybody has yeast in their intestines, and what I've seen happening over the 12 years of my practice is people who've been on antibiotic therapy for probably good reason, but maybe too long, prolonged antibiotic therapy, cortisone, high sugar refined diets, different things that can encourage the growth of the yeast in the intestines. What happens when the yeast overgrows in the intestines is that 79 different byproducts are formed from the yeast. They go into the bloodstream, and the body's immune system has to deal with those byproducts. Candidiasis is a condition of an overgrowth of the normal intestinal yeast or candida in the bowel. Chronic fatigue symptoms, swollen glands, headaches, extreme fatigue, and muscle exhaustion. Candida has those symptoms as well.